Hello friends, let us now learn some important points about the filters. Filtration. Filtration is a process of shaping the X-ray beam to increase the ratio of photons useful for the image for imaging to those photons and increase dose, patient dose or decrease the image contrast. It is the process of shaping the X-ray beam to increase the ratio of photons useful for imaging to the to those photons that increase the patient dose or decrease the image contrast. Diagnostic X-ray beams are composed of photons that have a whole spectrum of energies, that is polychromatic X-ray beam. Their mean energy is from one-third to half of their peak energy. So many photons fall in the range of lower energy range. So if this is the patient, so the photons are polychromatic radiation. So as polychromatic radiation passes through the patient, most of the lower energy photons are absorbed in the first few centimeters of tissue, and only higher energy photons penetrate through the patient to form the radiological image. Because the patient's radiation dose depends on the absorbed photons, higher energy photons can reach the radiographic images, whereas lower energy photons are absorbed by the patient's body. The first few centimeters receive more radiation than the rest of the body. So first few centimeters receive more radiation than the rest of the body of the patient. So this tissue can be protected by absorbing this excess radiation or lower energy radiation by certain material. So this tissue can be protected by absorbing the lower energy photons from the beam before they reach the patient by interposing a filter material between the patient and the X-ray beam. So what are filters? Filters are sheets of metal, and their main function aim of diagnostic radiology, their main aim in diagnostic radiology is to reduce the patient's radiation dose. So and they absorb the low energy photons. So in radiological examination, the X-ray beam is filtered by absorbers. Beginning the X-ray source, the filtration can be done by many materials. So there is inherent filtration where the filters, like not actually filters, inherent filtration where X-ray tube and housing could filter the radiation, whereas the second is added filtration where sheets of metals are placed in the path of beam. Then the third is the patient itself. So let us learn first about the inherent filtration. Inherent filtration results from absorption of X-rays as they pass through the X-ray tube and housing. So this is the X-ray tube. So as electrons pass, hit the target anode, X-rays are produced. As these X-rays pass through the X-ray tube and the housing, the filtration or absorption of X-rays occurs as they pass through the X-ray tube and housing. So this type of filtration is called as inherent filtration. The material which is responsible for this inherent filtration is glass envelope, which is enclosing the anode and cathode, insulating oil surrounding the tube, and the window in the tube housing. Inherent filtration is measured in aluminium equivalents, and this represents the thickness of aluminium that would produce the same amount of attenuation as the thickness of material in question. Inherent filtration usually varies between 0.5. So X is the thickness of the aluminium. So this inherent filtration varies between 0.5 and 1 millimeter of aluminium equivalent, and most of it is due to the glass envelope. So glass envelope is responsible for most of the inherent filtration. In few special circumstances, unfiltered radiation is desirable because filtration increases the mean energy of the X-ray beam. How? When we remove the low energy photons, as we remove the low energy photons, the mean energy will increase, because if we take 10 kilo electron volts, 50 kilo electron volts, mean energy is 30 kilo electron volts. But if you remove the first 10, now from 20 to 50 kilo electron volts, the mean energy will be around 35 kilo electron volts. So increase of mean energy by X-ray beam increases the tissue contrast. So by filtration, because filtration increases the mean energy of the X-ray beam, it decreases the tissue contrast. This decrease is insignificant in higher energy range. But with lower radiation under 30 kilo electron volt, the loss of contrast may be detrimental to the image quality. If lower energy radiation less than 30 kilo voltage peak is used, the loss of contrast is not desirable. So to prevent this filtration, we can use beryllium window tubes. So unfiltered beam, in order to produce an unfiltered beam, beryllium window tubes are designed to produce an essentially unfiltered beam. Okay. So this is the same assembly. So here these are the X-rays which are produced. The exit portal of the glass envelope is replaced here by beryllium, which is more, see, it is replaced by beryllium, which is more transparent to low energy radiation than glass. This beryllium allows low energy photons and has minimum inherent filtration. Then the next type of filtration is added filtration. Added filtration results from absorbers placed in the path of the X-ray beam. So this is the X-ray tube. These are the electrons bombarding, and this is the X-rays. So in between the X-rays, in the path of the X-ray beam, we place the certain absorbers which are called as added filters. The filter material should absorb all the, ideally the absorbers are placed in the path of the X-ray beam. Ideally, a filter material should absorb all low energy photons and it should transmit all high energy photons. But unfortunately, no such material exists. Because a material is selected, however, to absorb principally low energy radiation by utilization of photoelectric attenuation for low energy photons. So because of photoelectric attenuation at low energy photons which occurs in added filters, low energy photons are attenuated or absorbed. This attenuation is most intense when the photoelectric effect predominates and diminishes when Compton effect predominates. So energy of the radiation filtered by this beam can be regulated by selecting a material for the filters which is appropriate for appropriate atomic number. So filters regulate the energy of the filtered beam. So then energy of the filtered beam, energy of the radiation filtered from the beam can be regulated by selecting a material with appropriate atomic number. So generally in diagnostic radiology, aluminium and copper are the materials usually selected for diagnostic radiology as filters. Aluminium has an atomic number of 13 and it is an excellent filter for filtering low energy radiation, and it is a good general purpose filters. Whereas copper has an atomic number of 29, it filters some high energy radiation also. It is inconvenient to change the filters between the examination. As a result, we generally prefer using single filter material, that is aluminium. Copper. Copper should never be used by itself as a filter material. It is always used in combination with aluminium as a compound filter. The only reason for using copper is to cut down the thickness of the filter. So we use copper and we use aluminium together. So a compound filter consists of two or more layers of different materials. The layers are arranged such that the higher atomic number element, that is the copper, faces the X-ray tube, and the lower atomic number element, that is aluminium, faces the patient. So the most filtration occurs at the copper. Most filtration occurs at the copper, and the purpose of aluminium is to the most of the filtration occurs at copper. The purpose of the aluminium is to absorb the characteristic radiation which is produced by copper. Photoelectric attenuation occurs in copper. And when photoelectric attenuation occurs in copper at 8 kilo electron volts, it produces characteristic energy. When X-rays pass through copper, photoelectric attenuation occurs in copper, produces characteristic radiation with an energy of 8 kilo electron volts. This characteristic radiation is energetic enough to reach the patient and increase the significant skin doses. So to prevent that, the aluminium layer which is present on the patient side of the which faces the patient absorbs the characteristic radiation. Its own characteristic radiation is the aluminium absorbs the 8 kilo electron volt characteristic radiation of copper, and it produces its own characteristic radiation which is around 1.5 kilo electron volt, which is generally absorbed by the air gap between the patient and the filter. The use of compound filter is to cut down the thickness of the filter. Copper absorbs low energy radiation by photoelectric effect and at higher energy. So photoelectric effect is more common than Compton reaction. At higher energy, Compton reactions can also occur with copper, and it produces scattered photons. Okay, so these are the important points. So actually this is a wrong thing. So thank you.